Welcome back to Einstein's Eyes, where we talk about eye health, ophthalmology. We're ophthalmologists, innovation, healthcare related topics, finance, medications, all things relevant. And Jon and I trained together back at Albert Einstein College of Medicine back in the 90s. We had a great training program. We've stayed friends, and we're now co-hosts at Einstein's Eyes. Jon?
Hi everyone. I'm Jon Didkoff. I am a general ophthalmologist specializing in cornea and laser vision correction. I'm in northern New Jersey. I've been there for almost 30 years. And it's great that we get to do this and get to see each other, Carl and I, since we worked together many years ago.
Right, right. And Ron Bird was our chair. He was unbelievable. He's gone now, but we had a fantastic residency training program. So today, since we're ophthalmologists and I do oculoplastics now at Ophthalmic Associates in Anchorage, Alaska, we're going to talk about something called floppy eyelid syndrome. I know it sounds made up, it sounds goofy and weird, but it's a real thing. It's where the eyelids get too relaxed, or for their own good, really. They get elastic, they evert, and it causes lots and lots of problems. So it does sound quirky, but it's a real condition, and your upper eyelids get super stretchy. And I want to show you a picture. You can see a floppy eyelid patient, and when you pull the upper lids, they stretch beyond the normal capacity of what a typical person's eyelids would go. And this signifies floppy eyelid syndrome. It signifies what happens when you sleep, particularly if you're a side sleeper. The conjunctiva, or the pink area underneath the eyelids, get very thick and edematous. There's a lot of discharge. There's a lot of swelling and discomfort. Your eyes, you wake up, they're red, they're stuck together. It's just a really problematic situation. What we found is that it's related to being overweight and very noticeably related to sleep apnea. Now, sleep apnea is a condition where you're not oxygenating properly. I liken it to living at 12,000 feet rather than 1,000 feet, where your oxygenation saturation is low. It can be under 90% even. And that affects your whole being, affects your mental capacity, it affects your fatigue level, affects all organs. And people treat it CPAP. This doesn't look that comfortable, but I have to tell you, when you're treated and you compare before and after CPAP for sleep apnea, you feel like $1,000,000. You don't go anywhere without this because you just feel better. You think better. Your whole organism is elevated and you enjoy life. The whole message is sleep apnea, floppy eyelid syndrome is a real problem. It affects your eyelids. It affects your quality of life. It is, like I said, related to being heavy. As we mentioned, sleep apnea. It's related to rubbing the eyelids. If you have dermatitis or allergies, it's related to something called keratoconus, which Jon can talk about, which is a cornea that looks like a cone rather than a sphere, or a basketball, which is what our normal corneas look like, and related to Down syndrome. Jon, anything you want to say?
Yeah, I think that was excellent. I think, so let me give you my perspective. I've been in practice 30 years. I have hundreds and hundreds of patients that have floppy eyelid syndrome. The number one pearl, I would say, not only to the patients out there, but to the doctors, is that you got to think of it. So I've seen patients over the years that come in with chronic recurrent red eyes. It usually occurs in the morning, gets better during the day. The person will complain of some irritation, burning in the morning, or a foreign body sensation, or redness, or like Carl said, a puffy lid. And a lot of doctors are giving them steroids and giving them antibiotics, and they think they have blepharitis and dry eye. And you know the way to make the diagnosis? It's so simple. What typically I'd like to do, and back from our Einstein training, is that we were trained to always look under the lids, see if there's a foreign body in there, see if there's a reaction going on. And 9 times out of 10, when I go to lift someone's upper lid, there's resistance. It's tough. And I know they don't have floppy eyelid. And then once in a while, probably less than 1 out of 10, I'll go to lift their lid and it just pops right up. And I'm amazed. And that's when I think of floppy eyelid. So unless the doctor thinks about it, it's easily missable. And then what happens is once I flip that lid, if it flips really easily, almost without any resistance, that's what Carl mentioned. That's when I know that the tarsus and the muscle and the strength of the lid is not normal. Then I say, ooh, something might be going on. So as Carl said, these people, when they sleep at night, whether it be from some of the things you mentioned, sleep apnea or obesity, I've seen it also in nice, normal, healthy young guys. And they just predisposed genetically, they have a weak eyelid. So what happens is they'll go to bed at night, they're sleeping like all of us, and they go and they rub their head a certain way, and the eyelid just opens up on its own. So they're sleeping 3-4 hours with their eyelid open. And guess what happens? The eye dries out, it rubs against the sheets, they get inflammation, they wake up in the morning, they don't know why their eyes red. And so, how do we diagnose it? So, the first part is high index of suspicion. Secondly, what I've done in patients like this, where I see it in both eyes, is I tell the person, listen, and I instruct them, take a piece of tape. I want you to tape your upper lid to your lower lid, really stuck shut. So it's like this, it can't open, and go to bed. And tell me, I bring them back in a few weeks, and I say, how you doing? And some of those people come back and they didn't notice a difference at all. Some of them come back and they're amazed. It's like, hey, this eye is good. And my other eye is still getting red and inflamed. And then I say, you have floppy eyelid syndrome. That's how I confirm the diagnosis. Then I'm left with, what do I do? So one option is keep taping your eyelids shut at night. Second option is sometimes if you give them a gel or an ointment at night while they're sleeping, even though the lid flips open, it protects it so they're okay. And then the best treatment I find is sending them to a guy like Dr. Rosen. And Dr. Rosen does a very simple procedure that he could describe where he tightens the eyelid. And if he's able to tighten that eyelid, they're cured. They don't have to worry about taping the eyelid anymore, and they're done with it. So I think the key thing for me is always thinking of that diagnosis. When someone has a chronic red eye, if you look in the lid and like he said, it's very inflamed, there's a papillary reaction going on underneath the lid, but it can fool a lot of doctors. They think it's allergies, they think it's blepharitis, they think it's chronic dry eye. And I'm sure I've been guilty of being fooled by it. I'm sure any eye doctor's been guilty of being fooled by it, but you got to think of it.
Right. Yeah, great job, John. So, yeah, so as John's mentioned treatment. So, like John said, we do non-surgical. We have a non-surgical discussion. We talk about non-surgical options first. And if it's for mild stuff, lubricants, ointments, to keep the surface hydrated is great. The taping is good. I found that patient's skin doesn't like taping after a couple days. So, but maybe you have different,
Depends on
different,
the tape. We've used paper tape, and we've used the other tape.
yeah,
Right. There's a certain percentage of people that develop a sensitivity to it and they hate it. But I think for me, the most important thing is the diagnostic part. Like if they tape it and they tape one eye and they feel better, bingo. Now
yeah,
I
yeah.
know the diagnosis. And then we have to figure out. So have you done surgery for this? I mean, I know my
Sure, sure. Yeah,
yeah.
John, I do a bunch. And so there's a lot of ways to skin a cat. Some people do full thickness to they remove part of the eyelid and they tighten it that way. I like to work on the canthus, which is we call a lateral canthal tendon. I do a canthoplasty technique where I tighten, think of it like a hammock. I tighten one end of the hammock, and that usually does the trick. You are swollen, you are bruised for about 2 weeks or so, but folks really like it. They like having the eyelid opposed to the cornea the way it should be. And when it's tightened, they really enjoy it. And sometimes you have to do this multiple times over as the years pass by. But I've been here for 30 years, so I've had that. I've had those patients come back. Maybe after 5, 6, 8 years, we'll retighten it, and it's a 10-minute procedure, and it works very well. But uh, the whole point is you want to reduce that floppiness, and you want to oppose the eyelid again against the surface of the eye so it can act more appropriate, more physiologic. It can distribute the tears over the eye appropriately. It can help pump the tears into the drainage system or the lacrimal system, again, appropriately. But as John mentioned, we do conservative medical approaches first, and then we consider surgery. But as an oculoplastic surgeon, this is what I do. So anything else, John?
No, I think it's great. I think you gotta always think about it. If you're a patient out there watching the video and you're going from doctor to doctor with a red eye and you're not sure why, ask the doctor, hey, do you think I have floppy eyelid? Let's see how
Right. Yeah. So you got to say, am I always tired? Do I sleep poorly? Does my spouse or my wife or my husband, whatever, say I snore a lot, and are my eyelids always bugging me? If that's the case,
yeah, that
you
clinches
got to
it.
put two together and talk to your ophthalmologist. But like John said, you got to think about it. And if you don't think about it, you'll make up all these strange ways to treat something that it just won't help you. It won't
That's why
improve your quality of life.
one last thing I would say is most of the patients I've seen that came to me were second and third opinions. And a lot of them had been on steroids and antibiotics and ointments.
Yeah.
And when the treatment was boom, I mean, I taped their eyelid. Within a week, they were better. And then I recommended surgery if that wasn't going to be a good long-term treatment for them.
Right. Some people do wear goggles. It's a little cumbersome. The
Yeah.
side sleepers really have to think about, changing their method of sleep. It's tough. So if you're just not into it, go see an ophthalmologist or an oculoplastic specialist or a cornea specialist, get the diagnosis and then get the treatment, and it'll improve your life. But anyway, great stuff. Thanks for tuning into Einstein's Eyes. If this video was helpful, please give us a thumbs up, hit the subscribe button. And we're going to see you on the next one. Thanks a million, folks.